Florence Nightingale. Florence Nightingale changed the way the world thinks about medicine, hospitals, and patient care. She is widely considered the founder of modern nursing and one of the most important figures in public health history. Before Nightingale's work, hospitals were often dirty, dangerous places where disease spread rapidly. During the Crimean War in the 1850s, she travelled to military hospitals and witnessed terrible conditions. Soldiers were dying not only from injuries, but also from infections caused by poor sanitation. Nightingale introduced strict hygiene practices, improved cleanliness, and reorganised hospital care. As a result, death rates dropped dramatically. Her work proved that sanitation and proper nursing could save thousands of lives. She also used statistics and data analysis to support medical reform. This was groundbreaking at the time, especially for a woman. Her reports convinced governments and medical institutions to improve hospital systems and public health policies. After the war, Nightingale founded a nursing school in London that helped professionalise nursing as a respected career. Her methods spread around the world and influenced hospitals for generations. Florence Nightingale's influence became especially important during later wars and health crises. Modern nursing, patient care, and hospital hygiene all owe a great deal to her work. Beyond medicine, she helped challenge traditional ideas about women's roles in society. She showed that women could lead scientific, organisational, and humanitarian reform on a global scale. Today, nurses worldwide still honour her legacy, and her impact continues to save lives every day.